My practice background's fairly diverse. I've spent over 20 years at university. I spent a couple years in private practice before that, and I've been in my own referral type surgery sports medicine practice the last 5 years. Well, typically the type, I mean, we can treat multiple kinds. The majority that we're going to see are going to be the fresh acute injuries, any of those where we have any disruption of fiber alignment. I think those are the ideal ones to be treating, particularly if you have any core defects that you have to regenerate, because we can utilize the growth factors here to speed up and basically accomplish that regeneration, which may not even occur without some type of amnion growth factors or something to stimulate that. I look at it quite the in addition to. I look at it from an injury, what is best, and how far we can go with each horse as far as the clients will allow. If I'm allowed to do whatever I'm going to do, I would typically go with shockwave therapy, then followed up right after that with amnion, because we can stimulate neovascularization with the shockwave, can maybe decrease some of the edema and inflammation initially, follow it with the amnion, and then come along and continue that healing with additional shockwave therapy. So if I'm giving my druthers, they're typically going to be used in parallel. Well, the benefits of using shockwave is I think they're additive. So you can use shockwave, and which is fairly well documented that there are positive effects in tendon and ligament healing. We clearly recognize the benefits of the growth factors in the amnion product, and how they stimulate healing, and we can just simply add those together. As far as negatives, you know, I mean, it'd be pretty much as long as we have, you know, healthy tissue, no infection. I don't know that there is a lot of negative associated with either treatment. Well, I think it has to do with, we know that the shockwave leads to some neovascularization. Some things would suggest that it decreases some of the inflammation, and they're different. With amnion, you're adding growth factors in there at a nice mixture, naturally occurring mixture. We know that the shockwave actually stimulates the cells themselves to produce growth factors. So we're basically adding growth factors, stimulating growth factors. We're approaching the same objective two different ways for that additive benefit. There's a lot of personal preference in that. I think ideally you would typically go side by side when you can in most cases. If you're going to go one and then potentially the other, I would probably go with the amnion in the, you know, following the initial inflammatory phase, get those cooled out with anti-inflammatories and ice, utilize your amnion, and then evaluate your progress, and then you may turn around and add shockwave into that as the future progresses. If you're going to look at it from one then the other, that's kind of how I would approach it. Well, I think what you should consider is I think is just maybe more of looking at the entire package. I think one is we're treating injured tissue, but when we start our treatment, we want to maximize it. So controlling the initial inflammation by some mechanism prior to these therapies, you know, and even if it's brief, 2 or 3 days of ice and anti-inflammatories, get the initial inflammation under control, and then try to move your healing process along quicker, I think is probably something not everybody thinks about. But to maximize the benefit of our therapies, just some brief period of time, initial inflammation control is ideal.